All right, here we start into lesson plan 3, and this is focusing basically on self-awareness and therapeutic communication. So we're going to start with chapter 7, and if you notice on your lesson plan, pages 112 through 114 and 120 through 126 are the ones that I really want you to focus on, with the rest of them basically being recommended readings. The rest of the readings in this chapter just covers the different theorists, different ideas in between self-awareness, self-reflection, self-concept, and those things. So you might want to look over those chapters just to familiarize yourself with, or those readings just to familiarize yourself with some of those other theorists that we're looking at. I've talked a little bit in lectures before about being aware of yourself, being aware of your concerns, your culture, your ideas, and that's kind of what this chapter focuses on more in depth. We're going to talk a little bit about what self is. Self, according to the definition, is basically the union of elements that constitute the individuality of a being as well as the conscious of one's being. For each area of nursing practice that directs nursing deliberately puts into service purposeful use of self. Certain skills essential for the technical tasks of a specialty. When you're talking about medical, I talk about you have a stethoscope, you have those tools that you have to have, a blood pressure cuff, a thermometer. In mental health or in psychiatric nursing, the tool that you have is self. It's the essential skill in psychiatric nursing. It's the consciousness of one's being, the consciousness of who you are. Again, it's the tool of practice that we use, the reflecting, the understanding, and the supporting growth of the nurse's self, who you are, what you believe in. And as you read this, section, especially on page 111, it talks about the different theorists and how they feel that self works its way into being a nurse. And in order to understand ourselves, everybody thinks they know who you are, or you think you know who you are. But to really understand who we are, we have to really we have to look at ourselves. Psychiatric nurses reflect an endless, evolving self. Theories alone cannot divine interventions to facilitate evolution. This is something that you have to do on your own. And to do that, we self-reflect. And I know I've talked a little bit about that in previous lectures, but that's what this basically is. Self-reflection allows the nurse to examine one's actions, motivations, and feelings. What do I think about this situation? What do I think about this issue? What do I think about this concern? And as you grow in this profession, that is something that becomes really, really important to you. As a nurse, either medical, mental, OB, peds, ER, whatever that you do, you are the patient advocate. You have to stand for what that patient wants. And in order to do that, you have to kind of know about the issues, about what's going on, and how you feel about it. Again, if you remember me talking about abortion and tubal ligation and all that at a Catholic hospital, if you feel that it's the woman's right to have those and you work at a Catholic hospital, that's something that you might want to self-reflect to say, are these motivations, are these actions, are they really helping me provide the best care for the patient? Self-reflection also helps make sense of actions in context of relationships with patients. When you self-reflect on yourself, it also helps you understand what's going on with that patient, what's going on with their ideas, their thoughts, and their concerns. So we have to do that. We have to understand what self-concept is too. Self-concept, that's kind of who we are, what we think of ourselves. It's the relationship between the real self and one's ideal self. Where do we picture ourselves at? How does one characterize oneself, including your thoughts, your attitudes, your feelings, your beliefs, and your own personality? That's your self-concept. That's who you are. You heard people having poor self-concept, poor self-esteem. That's people who cannot rationalize those issues. being able to distinguish what self-concept is, and they don't have a adaptive or a correct way of dealing with the thoughts and attitudes and feelings about one's personality, oneself. They're normally a negative connotation. Body image, that falls into self-concept. Not only do we have to see, the real self and our ideal self, how do we, what's our body image? How do we feel? Do we feel like we're fat? Do we feel we're thin? Do we have an ugly nose? Do we have ugly ears? That's our body image. How one views one's own body in relation to how people perceive values and beauties, as well as other perceptions. Again, that's very important. That plays a lot into your self-concept, your self-concern. If everybody needs to be pencil thin and you're not pencil thin, then you might have a poor body image, which results again in that poor self-concept. Body image also standards are high culture dependent standards. If you look back on what an ideal person should have looked like in the 50s, you have Marilyn Monroe, who is very curvaceous, very busty. She's not that pencil stick thin that we see today. Again, those body images are highly cultural. Another thing that we look at in self-reflection and trying to identify ourselves is our body space. What's the distance that provides comfort in social situations? Intimate, personal, and social and public parameters. The proximity of the use of body self. You've heard people talk about invading personal space. How does that affect your self-concept? How do you feel about that? Again, those are things that you got to look at. What's an intimate idea? What's an intimate body space? What's a social body space? Another thing when we're self-reflecting or trying to identify our own self, we have to look at our social roles. Where are we at in society? Where do our roles fall? Are they chosen, or are they acquired? Are they without voluntary decision making? There's gender identities, or there's a role of a student. There's sibling roles. There's household roles, husband roles. So, your concept or your self-concept also has to do, what is my role in society? What do I do? Where do these roles fall? If you're a mother and your social role is that of a mother, then is it, can you take care of someone who aborts their baby? And I use that because it's normally a hotbed topic. But you can kind of see the parameters there. Can you do that? Is that something that you have to look and say, that's myself, that's my concept, that's my role, my self-esteem, that is ingrained and that's in part of me. So if that's the case, can you provide the care in a non-judgmental role to this patient? So again, you have to look at those those roles that we have. Self-esteem. It's based on an overlap between ideal self and actual self, and it is believed by that individual. It is your self-esteem. It is how you see, feel, think about yourself. It's based on all these overlapping ideas of self, your role, your concept, all those, and it's actually what you believe you are. I'm talking about body image. If you have a poor body image, or if your body image, sorry guys, I normally yawn when I start doing this. If your body image is negative, then you're going to have a lower self-esteem. Those who have low self-esteem normally experience negative outcomes. It's a cycle. It feeds itself. Stability of the living environment, supportive parental figures, an opportunity to be praised for one's successes supports development of a positive self-concept. If, the old adage is, if you always hear negative, 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 then you're always going to produce negative, negative, negative. We have to have a constructive, supportive base in order for someone to turn those ideas around. Again, so we have to understand looking at these things and how important they are in psychiatric nursing. And to do all this, to look at your self-concept, to look at your self-esteem, to look at your body image, your space, your social roles, all those things that make up a self. How do you do that? Well, you have to reflection. There's a process of reflection. It's on page 113 in your book, table 7.1. It talks about stage 1, stage 2, so what, and stage 3 is now what. So there's that stages that we go through, that we reflect through. Thinking and feeling behaviors that are used to create and clarify the meaning of an event. The meaning of what does that event make me think and make me feel? You know, where does it add up into my self person that I am? Results in a greater understanding of own's convictions and values. So when we reflect on something and we're looking at those thinking and we're looking at those feeling behaviors, it results in you understanding where you are on events in life, where you are on topics, where you are on things that are important to you. It requires preparation, and you have to have a desire to do this. You can go through life and never really understand who you really are, but to be a good provider, a good nurse, and be able to provide the care, not only on the medical side and the mental side, you have to have a desire to know who you are and what you stand for. You can choose choice of what and how much to reflect. That's up to you. If you look at this process of reflection on page 113, it says stage 1 is what? Your willingness and openness to perform a self-assessment. Focus on thoughts, beliefs, and feelings related to an experience. Struggle between comfort and discomfort. And thinking about a situation prior to having to deal with it. So what? What is it? What am I looking at? Why am I looking at the issue of this hospital not being able to do tubal ligations? Why is that a concern with me? So what is it? So I struggle with it. I look at it. Then I say, okay, so what now? Critical analysis and exploration of the alternatives. You know, what can happen? You got to look at the other side. Look at the flip side of the coin. The grass is not always greener on the other side. Determining the strengths and areas for development. Thinking about the situation in the moment using self-awareness, existing knowledge, and previously learned knowledge. Then after you figure that out, you go to now what? Your judgments concerning different or same actions in the future. So we've looked at it. Are we going to address this issue the same in the future? Or have I looked at it and say, you know, I really don't feel that way. So I think in the future, when this issue arises, I might choose a different action or a different path and commit to that change if change is necessary. You can formulate an action plan and thinking about the situation after it happens and processing to make sense of it in order to improve future decisions. And that's what all this is really truly about. You know, how can we in the future make better decisions? And anytime you can self-reflect, notice your awareness, you're going to grow from it. And that's the big thing. Self-awareness, on this slide, it basically says capacity to identify, process, collect information about one's internal mental state and public behaviors. So you're making yourself aware. You include general physical appearance, individual reflects on and speaks to themselves, and growth involves receiving that feedback and self-disclosing this information to others. You have to be able to do all these. Looking at this, I want you to see it. It's also a picture in your book on 113. I'm not going to test you on this, but I want you to understand. This is called the Johari window, and this is going to help you understand where stuff falls in our capacity of self. If you look at this, you're going to see 4 boxes. You're going to see one that says unknown to others. So this is stuff that is strictly you. You are the only one that knows this stuff. It is unknown to everybody. Then to the left, you see the one that says known to ourselves. Excuse me, go back to the one. This is unknown to ourselves. These is unknown things that we haven't discovered yet. I'm sorry. That's what this first box is on the bottom right-hand corner. That's the unknown area. It's not known to anybody. These are things that we've not discovered about ourselves or nobody's discovered about us yet. On the one on the left now, it says known to ourselves, but unknown to others. So it is known to us, but these are the things that we keep hidden from people. We don't want people to know certain things about us for whatever reason. Maybe you don't feel that they will accept this, whatever it is, or maybe the group of people that you run with, your view is not their view. So it's known to you, but it's not known to anybody else. And then on the top, it says the open area. This is what everybody knows. Okay, this is the known to everybody. Everybody knows these things about you. And you know that's your public knowledge of everybody. Then if you look on the other side, there's a side there that says the blind window. The blind area is just that. It's a blind area. It's closed off. Nobody can really see into that area. That's where you get your feedback. Now let's look at the other ones. Here we have something that says disclosure, self-discovery, and feedback. We want to open this open area. This area needs to be bigger than all of these other areas. And the way we do that is stuff that we know that are not known to others, we can disclose it. We choose what people know about us. But the more that we disclose, the more elements that are known of the self that are available to others, it filters, interprets, and copes with the feedback provided by the environment. So the more area that is known, there's more area for you to help people with. This unknown area, this is self-discovery. These are things that we discover about ourselves on the way. And our blind area is where we get feedback. So this area we want to be able to grow by giving feedback to other people, having disclosure, and also some self-discovery. Like I said, I'm not testing you on this, but you can kind of see where these areas fall. And you want that to have a good therapeutic self, use of therapeutic self, you have to have a big open area. The larger the area known to self and others, the more elements of self that are available to interpret and cope. I read that already. Consistent enrichment and using self can be energizing and exhausting. Actually, the more you give of yourself, the more emotionally tired that you can be. So you have to remember that as well. Let's talk a little bit about perception, thoughts, and feelings. And I think it starts on page 120 in your book. Perception. This is the capacity of the five senses. When I say a perception, there has to be one of the five senses involved in order for you to perceive something. It's primary process by which the individual collects and clusters sensory data. So that's your perception. What do you see? How do you perceive this? How do you feel this? That's a perception. How do you smell it? That's a perception. That's a perception. Self-generated actions establish sensory motor systems in the developing brain. It begins at birth and attention to the stimuli that are very useful. So basically, as when we're born and our senses start to develop, we start to perceive things. We start to have our own thoughts and we start to have our own feelings of things as we grow. And, those thoughts and those feelings are very important in the development of self or the characteristics of the self. So basically what you have is your cognition or thoughts as described as more complex processes creating order and meanings from experiences. You also have your emotions, the affective response. Our feelings or emotions are believed to arise from a reaction to the meaning ascribed to the perception and thoughts. Then you have empathy. Remember, if you don't understand the difference between empathy and sympathy, we're going to talk about it a little bit, but you need to understand. Empathy can be defined as understanding and experiencing the feelings, thoughts, and experiences of another from another's perspective, connecting with and feeling what the other person is feeling. Remember, sympathy is an act. Sympathy is an actual behavior. So you have to understand the difference. But empathy is a characteristic of self. With perception, we can also have what we call attentional blindness. Perception is what you see, hear, feel, those type things. But also you can have some blindness in related to that. research of Chabris and Simons come up with the intentional blindness, and that's basically seeing what is important and paying very little attention to other visual stimuli. And they basically come up with this. They had a bunch of college students, and they had them in a gym, and they were, or in a room, excuse me, not in a room. They were watching a video of a gym, and they were asked to count how many times the basketball was passed back and forth amongst each other. And of course, they had good things and bad things. If they got it right, then they won something. If they didn't, that type thing. But they had to count as many times on the video that people passed the basketball amongst themselves. If you notice the next little bullet there, failure of 40% of the people that done this, failure to notice that a gorilla came into the room, slowly into the middle of the group who were passing the basketballs, turned to the camera, beat his chest, and then walked out. People didn't notice it because they were focused on what was right in front of them. We have to understand that, you know, in mental health, we can't have that. We have to be able to look at the big picture, the big perception. We can't get tunnel vision, and that's basically what it is. Another thing that Braceless and Dunning came out with, they used a sophisticated ocular tracking thing. It's called a B or a 13. And it basically, they done the same thing. They showed them a picture. I'm going to show you the exact picture here in just a second. And they said if they saw the number 13, they were directed to a group that would have a good tasting drink. If they saw the letter B, they were directed to a group that had a bad tasting drink. And again, they focused on the positive versus the negative and had their mind set that they were going to see the 13, and lo and behold, that's what you see. So if I tell you to look at this and say, if you see 13, I'm going to give you an A. If you say B, I'm going to give you a D. You're going to see the number 13. That's attentional blindness. You don't look what's beyond the intentional thing that I've got you directed at. And we have to be careful not to do that. I have to be able to look at the big picture. Cognition is a characteristic of self. Piaget, basically, if you're not familiar with that name, look it up. He came back and said behavior is organized and planned through cognitive processes. They're schemes. That's what Piaget came up with. Described as more complex processes creating order and meaning from experiences. He hypothesized that infants are born with scheme operating at birth, which he calls reflexes. He also described two processes used by individuals in attempt to adapt: assimilation and accommodation. Both of these processes are used throughout life as people increasingly adapt to an environment and become more complex in manner. Assimilation, however, is the process of using or transforming the environment so it can be placed in a pre-existing cognitive structure, understood in relationship existing knowledge. And then accommodation, again, is the process in changing cognitive structures to accept something from the environment. So that's basically what Piaget says. He says the concept of self through cognition, basically you assimilate things or you accommodate for things. And that's basically what we're looking at there. Emotions. We have what we call emotional intelligence. This is measurement of interpersonal phenomenon. It's an affective response, as feelings are an integral element of self. Recognizing what one feeling is highly relevant to nursing practice. We have in contrast to intellectual or IQ, you have the emotional intelligence. It's accurate, conspicuous perceptions and monitoring of one's own emotions, modification of one's emotions so that their expression is appropriate, accurately recognition of and response of emotion in others, skills in negotiating close relationships with others, and capacity for channeling emotional energy to goal achievement. So basically, emotional intelligence is, can you handle your emotions? Are you mature enough? Do you have control over your emotions and understand what they are in order to be able to deal with those? Becoming aware of how one is feeling provides insight into a particular emotion. Um, Accurate perceptions, monitoring one's own emotions. I think I covered these. Managing emotions to be appropriate, recognizing and responding emotions to others, being able to recognize if somebody's sad, happy, depressed. Skills in negotiating to try to get people to open up, and channeling energy for goal achievement. Then we have empathy. I gave you the definition of empathy a minute ago. Understanding and experiencing feelings, thoughts, and experiences of another from some other person's perspective. Again, if you're doing sympathy, sympathy is the action. Okay, it involves separateness from another painful experiences, and it doesn't engage the core function of the nurse. You want that empathetic behavior. Authenticity. If anything in relation to self that's most important, it's authenticity. We have to be genuine. Our personality has to be genuine. When you walk into a room, what they see is what they get. It's no different than if they see you in the grocery store versus them seeing you in the room. They have to be able to say, you are a genuine person. There's no fakeness about you. It's demonstrated behavior that is consistent with your awareness. Patients reportedly seek providers who say it like it is and being honest. Nursing, again, is ranked the #1 honest profession out there, and we pride ourselves in that. So you have to understand, you have to be authentic. You have to be able to provide that honest feedback. And a lot of people will ask, what if someone wants to know the bad news? What if someone says, asks you a question, am I dying? My response always to patients, even when I was working with hospice, and families would say, oh, I don't want my family to know they're on hospice. I don't want them to know this, and I don't want them to know that. My response always would be, I'm not going to lie. If they ask me point blank, then I'm going to tell them point blank, because I am not going to lie. I will do everything in my power to avoid answering the questions without becoming an honest, or without giving a perception of not being authentic or genuine. So you have to make sure people know, if you ask me, I'm going to tell you. Be knowingly present in own life and interacting with full unknowingness about the other. You have to be authentic with patients. An authentic existence, individually fully aware of the present moment, chooses how to live the life in the moment, and takes responsibility for that choice. Nurses' authenticity reflect in how nurses direct energy towards getting to know patients as patients is in that patient's world. Consistency between one's own actions, physiological state, and awareness of the behavior, emotional expression, and of that state. You have to be able to have that consistency. You can't be wishy-washy. You can't be all friendly and then the next day not be friendly. People don't like that. Questions of authenticity are, how do you convey the trustworthiness? Again, you've heard us say it before. If you say you're going to do something, then do it. Don't be wishy-washy with things. How to communicate clearly and sensitively with others, and seeing the world from somebody else's perspective. That's always really important. And it's also really hard. The walk a mile in someone's shoes, that is a very important statement. Comparing strategies that support the nurse's use of self. So let's look at some strategies. I'm just going to mention a few for therapeutic use of self, and that's mindfulness. State of being in the present moment and accepting things for what they are without judgment. Mindful individual is responsive and deliberately aware of his or her conscious decision to respond. So you have to be mindful. You have to think. You have to, put that mouth filter on. Take just a minute to be in that moment, accepting of things without judgment. Presence. All of one's attention and energy are focused in the moment on the purpose of that moment. Nurses can learn to achieve this state. The more present we are, the more meaningful our lives become, the better nurses we are. Being willing to go where patient leads, share and safely share experience of suffering and issues also helps that therapeutic relationship with the patients. Discussing how the nurse's therapeutic use of self can provide support to patients with mental illness. Basically, it's the opportunities. We provide positive influence, direct provisional care, and we model and teach. We say what we're going to do. We're authentic. We give them the tools that they need to provide those things that they have. Patient narrative. We listen. Point at which growth and development potential may begin. We listen. We listen to their source of suffering. Nurse as a caretaker of suffering. That's what we are. That's who we are. We handle those suffering situations. We deal with the issues that are at hand. We help that patient work through the problems that they have. Suffering, individual state of endurance, surpassing, concealing, and releasing active suffering. We want to get rid of that. Paradoxical choice of engaging release, likely to cause distress in empathetical responding individuals and may increase suffering. Efforts to conceal suffering motivated by shame, stigma, and mental illness. Typically, human emotions responses may be interpreted as pathological if an individual receiving treatment for the mental illness. People don't like mental health. People don't want to say that they are seeking mental health or they're taking this medication. So we have to be careful to conceal what's going on, that HIPAA violations. We want to make sure that we don't cause this patient any more undue stress because of the emotional responses that they receive. Suffering and shame restricts patients' willingness to risk being open to care. So we have to make sure we reduce that suffering and shame. Patients create facades to protect themselves from painful experiences. I'm not going to my therapist, I'm going to Lowe's. So we have to make sure that we understand that. The nurse should engage in a caring conversation with the patient to work towards patient self-actualization. Establish an interpersonal bridge. Be cognizant of that facade and its purpose. Create time and space for patients to share stories and confirm the patient's role in pacing the care. Being able to understand one's own behavior to help others to identify difficulties and to apply principles of human relationship to that problem that arises at all levels of experience. These are the functions of a psychodynamic nurse. Just wanted to leave you with that last tidbit.